Okay, so let's jump right into part one of the blood vessels. Here are some general terms that you need to know. Well, first off, you need to know what a blood vessel is. The blood vessels are the delivery system of dynamic structures that begin and end at the heart. So blood circulates throughout your body constantly. Blood either enters the right atrium via the superior vena cava or the inferior vena cava coming from the systemic circulation. A drop of blood that you find in the right atrium, 1 minute later, will have circulated throughout your entire body and be back in that exact same spot in the right atrium. Next, I want you to be able to classify and categorize arteries, veins, and capillaries from largest to smallest. So arteries are the largest. Arteries are what your blood pressure readings come from. So when you go to your primary care physician and you get the blood pressure cuff put around your brachial artery and you get a blood pressure reading of 120 over 80, your systolic pressure is 120 and your diastolic pressure is 80 millimeters of mercury. That's a good blood pressure to have. You're basically reading the blood pressure from the brachial artery. Another thing to know about arteries is that arteries carry blood away from the heart. I always remember this: arteries away. Arteries begins with A. Arteries carry blood away from the heart. Arteries are oxygenated except for in the pulmonary circulation and in the umbilical vessels of the fetus. Next in size are your veins. Veins carry blood toward the heart, and veins are deoxygenated except for in the pulmonary circulation and in the umbilical vessels of the fetus. And then the smallest of the three are the capillaries. And the capillaries are in direct contact with tissue cells, and they directly serve cellular needs. This slide here summarizes how the vascular channels relate to one another and to the vessels of the lymphatic system. The lymphatic system recovers fluids that leak from the circulation, and they're described later on in the lymphatic lecture. So don't worry about those too much right now. All I want you to know is the general schematic of what's going on here, and that the lymphatic system recovers fluids that leak from the circulation. That's the big point on this slide. So this picture here depicts a generalized structure of what an artery, a vein, and capillary look like in a cartoon schematic. So all vessels consist of a lumen, which is the hole that you see depicted by the arrow, the red arrow pointing into the artery and the blue arrow pointing out of the vein. It is a central blood-containing space surrounded by a wall, and all walls of the vessels except the capillaries have 3 layers or tunics. First, we're going to start from the inside out. We're going to go from the tunica intima to the tunica media, and then finally the externalmost layer, the tunica externa. So let's begin by talking about the tunica intima. It's the innermost layer that has an intimate contact with blood. The endothelium is comprised of simple squamous epithelium that lines all the lumens of all the vessels. It's continuous with the endocardium, and it has a slick surface which reduces friction. The subendothelial layer of the tunica intima is a connective tissue basement membrane, and it's found only in vessels which are larger than 1 millimeter. Now the middle layer, or the tunica media, you'll find this in smooth muscles and elastic fibers. It's mainly composed of sheets of elastin. Sympathetic vasomotor nerves innervate this layer, and they control vasoconstriction and vasodilation. So vasoconstriction decreases the lumen diameter, and vasodilation increases the lumen diameter. Of all the layers that we're going to talk about, the tunica media is the bulkiest layer, which is responsible for maintaining blood flow and blood pressure. And now we're going to talk about the outermost layer of the wall, which is known as the tunica externa. It's also known as the tunica adventitia. It's composed mostly of loose collagen fibers that protect and reinforce the wall, and it anchors it to the surrounding structures. Throughout the tunica externa, you're going to find lots of things such as nerve fibers and lymphatic vessels. Large veins also contain elastic fibers, or can be found in this layer. This picture is depicting elastic arteries, muscular arteries, and arterioles in descending order from the ones with the largest diameter, which are the elastic arteries, down to the ones with the smallest diameter, which are the arterioles. I do want you to know that the elastic arteries do have the largest diameter. They're measured in centimeters. Then the muscular arteries, they're usually measured in millimeters. And then finally, the smallest of them all are the arterioles, usually measured in micrometers. So this picture depicts the arterioles, the capillaries, the venules, and the veins. You can see visually the veins have the largest diameter, then the venules, then the capillaries, then the arterioles. So I do want you to know, going from largest to smallest, starting from the bottom and going up in this picture, the veins have the largest diameter and the arterioles have the smallest diameter. So please be aware of the diameter and the thickness of each of these specific entities. So again, as mentioned previously, the arteries can be divided into three groups based on their size and functionality. Remember, we said that the elastic arteries are the largest and the arterioles are the smallest, and the muscular arteries being the middle size. The elastic arteries, for example, the aorta and its major branches are elastic arteries. They're also called conducting arteries because they conduct blood from the heart to medium-sized vessels. And they have elastin found in all three of their tunics, the tunica media, the tunica intima, and the tunica externa. But however, most of the elastin is found in the tunica media. The elastic arteries contain substantial smooth muscle, but they're not active in vasoconstriction. They act as pressure reservoirs that expand and recoil as blood is ejected from the heart. And they also allow for continuous blood flow downstream, even between heartbeats. Now let's move into the muscular arteries. The muscular arteries arise from the elastic arteries, and the muscular arteries are also called distributing arteries because they deliver blood to different body organs. Their diameters range from pinky finger size to about the size of a lead-based pencil. And they account for most of the named arteries. The muscular arteries have the thickest tunica media with more smooth muscle but less elastic tissue. And the smallest of the three now are the arterioles. The larger arterioles can contain all three tunics, but the smaller of the arterioles are mostly a single layer of smooth muscle surrounding endothelial cells. The function of the arterioles is to control flow into the capillary beds via vasodilation and vasoconstriction of smooth muscle. Arterioles are also known as resistance arteries because changing diameters changes resistance to blood flow, and they are constantly changing based on what type of events happening and how blood flow is changing throughout the body. The capillaries are the microscopic vessels. The diameters of the capillaries are so small that only a single red blood cell can pass through at a time. We're going to talk about the biconcave disc shape of red blood cells and the functionality they serve when we talk about the blood chapter. The capillaries contain what's called pericytes, which are spider-shaped stem cells to help stabilize the capillary walls. They also control permeability, and they play a vital role in vessel repair. The capillaries supply almost every single cell, except for cartilage, epithelia, the cornea, and the lens of the eye. Everything else is supplied by capillaries. The main functions of all capillaries are to exchange gases, nutrients, waste, and hormones between the blood and the interstitial fluid. And depending on where the capillaries are found throughout the body and the function that needs to be achieved, capillaries are going to come in different types. They can either be continuous, as depicted in the top of this picture. They can be fenestrated, which means they have large pores in order to increase permeability, or they could be what's called sinusoid. And these are the most permeable, and they occur in very, very limited locations. Mainly, you're going to see continuous and fenestrated capillaries throughout the body. The sinusoids, they do exist, but you can find those in the liver, the bone marrow, and the spleen and the adrenal medulla, but other than that, you're not going to find those in the body. So all capillary endothelial cells are joined by tight junctions with gaps called intercellular clefts. And the purpose of these is to allow passage of fluids and small solutes. So let's begin by talking about the continuous capillaries. They're found in large abundances in the skin, the muscles, the lungs, and the central nervous system. And the continuous capillaries of the brain are unique because they form what's called the BBB, or the blood-brain barrier. Next, we have the fenestrated capillaries. These are found in areas that are involved in active filtration, such as the kidneys. The whole purpose of the kidneys is to filter out the fluid throughout your body and to make urine. When we get into kidney physiology, you're going to learn about the nephrons. We have over 1 million nephrons in each kidney, and the kidneys are really an amazing organ. Fenestrated capillaries are also found in the intestines. The purpose of them in the intestines is for absorption, especially absorption of nutrients from our food. And we're going to talk about the areas of the intestine. We're going to break down the intestine from the small intestine to the large intestine and teach you about the duodenum, the ileum, and the jejunum, and what goes on in those different areas. Fenestrated capillaries are also involved in endocrine hormone secretion. And endothelial cells that are found in the fenestrated capillaries, they contain Swiss cheese-like pores called fenestrations, hence the name fenestrated capillary. They allow for increased permeability, and the fenestrations are usually covered with a thin glycoprotein. And last but not least are the sinusoid capillaries. The sinusoid capillaries have fewer tight junctions, and they're usually fenestrated with large intercellular clefts. And they don't have a complete basement membrane. The basement membrane gets disrupted. And they usually have larger lumens compared to the fenestrated and the continuous capillaries. Sinusoidal capillaries, as I mentioned earlier, are only found in the liver, the bone marrow, the spleen, and the adrenal medulla. Blood flow through the sinusoidal capillaries is sluggish, but the purpose of this is to allow more time for modification of large molecules in blood cells that pass between the blood and the tissue. Also found in the sinusoidal capillaries are macrophages. Macrophages are found in the lining of the capillaries, and the whole purpose of the macrophage to be located there is to capture and destroy foreign invaders that may be present. Capillary beds are interwoven networks of capillaries which are found between arterioles and venules. They're responsible for the microcirculation of blood flow. And the capillary beds consist of two types of vessels. We're going to talk about the vascular shunts and the true capillaries. The vascular shunts are the channels that connects the arteriole directly with the venule, while the true capillaries are the actual vessels that are involved in the blood exchange. The vascular channel starts with the terminal arteriole, which then feeds into the meta-arteriole, which is the intermediate between the arteriole and the capillary. And that's continuous with the thoroughfare channel, which is the intermediate between the capillary and the venule, which ultimately feeds into the postcapillary venule, which drains the bed. The true capillaries branch off the meta-arterioles or the terminal arteries, and they normally return to the thoroughfare channel. The precapillary sphincters regulate blood flow into the true capillaries, and blood can go either into the true capillaries or to the shunt. It depends on many different features and aspects. However, the true capillaries are regulated by local chemical conditions and specifically vasomotor nerves. So depicted here is a hematoxylin and eosin histological stain of an artery and a vein. You can see the artery on the left side with the much larger and more shapely diameter compared to the smaller diameter, which depicts the vein on the right side of the picture. Remember, one of the big differences between the arteries and the veins is that arteries carry blood away from the heart, while the veins are bringing blood towards the heart. So the veins have a lower blood pressure than the arteries. So there are certain adaptations that veins have which ensure the return of blood flow to the heart. Veins I always remember V and V. Veins have valves. So if you think about how the blood flows through our body on a daily basis, the blood has to go from our heart up to our head and back down to our feet and circulate systemically. But how does the blood go from our feet back up to our heart? Doesn't gravity just keep it suppressed down the entire time? And if it wasn't for the valves in the veins, gravity would supersede, and basically we wouldn't be able to have blood flow return to the heart. So because of the venous valves, they allow blood to return to the heart. They also prevent backflow of the blood, and they're most abundant in our limbs. We also have what's called venous sinuses, and these are flattened veins with extremely thin walls. They're composed only of endothelium. And a few examples are the coronary sinuses of the heart and the dural sinuses of the brain. This pie chart depicts the relative proportion of blood volume throughout the cardiovascular system. As you can see depicted in blue, 60% of the blood volume throughout our vascular system goes through systemic veins and venules, then followed by systemic arteries and arterioles, then the pulmonary blood vessels, the heart itself. This will be a test question. I'm going to ask what particular sinus of the heart supplies blood to the heart itself. So blood is coming into the heart from the inferior vena cava and also through the superior vena cava, but the heart itself has its own blood supply, and that's via the coronary sinus. So that will be a test question. Please note that, highlight that, remember that fact. And then the remaining 5% is circulating through the capillaries. So learning about veins and valves and arteries and arterioles and venules is all well and great, but we really need to learn how to apply our knowledge in a clinical setting. One of the cases in the clinical setting that many of you will experience throughout your healthcare careers, you all will see what's called varicose veins. These are dilated and painful veins due to incompetent or leaky valves. Some factors that contribute to the development of varicose veins include hereditary and conditions that hinder venous return. So somebody who has an occupation where they have to do prolonged standing in one position, varicose veins are highly prevalent amongst the obese, and they can also develop during pregnancy. So what is actually happening is blood is pooling in the lower limbs, the valves become weak, and they become leaky and incompetent. And this condition actually affects more than 15% of the adult population. The elevated venous pressure, which can cause varicose veins, can also lead to other clinical symptoms such as hemorrhoids. Hemorrhoids can be seen in pregnancy. For example, when a woman who is straining to deliver a baby, or somebody is having a bowel movement that raises intra-abdominal pressure extremely high, there are varicosities that can result in the anal veins, which are termed hemorrhoids. So this is another clinical situation and scenario that you can see in tangent with varicose veins, or with people who have prolonged standing and display the varicose veins, and also it can be seen during pregnancy, during the delivery phase of pregnancy.